I'm Maggie Gill, the CEO of the Palm Beach Health Network, and today we're turning the page from Candid on COVID to Candid on Care. We've come a long way since the early days of this pandemic. We have developed safe processes in our hospital. We have separate tracks between COVID and non-COVID patients. We've learned how to social distance. We have appropriate PPE. We have safeguards in place. We have trained staff, and we're ready to take care of your healthcare needs. But we understand you haven't been inside our hospitals for some time. We've all been practicing the safe protocols to flatten the curve of the virus, and we're doing a good job at that. So what we want to do right now is give you a glimpse inside of our 5 hospitals in different areas to show you that we're safe. Talking to our doctors, talking to our leaders in the emergency department, in the operating room, in the cath lab. So let's go to our 5 hospitals now and take a look at what's going on inside the 4 walls.
I'm Teresa Urquhart. I'm the CEO for Palm Beach Gardens Medical Center. And joining me here today is Dr. Jyoti Mohanty. He is an interventional cardiologist here at Palm Beach Gardens Medical Center. And we are here in the 4 walls of one of our cardiac catheterization labs. And what we are here to do is to tell you that we are ready to go to work. The governor's executive order allowed us to be able to do elective procedures and surgical procedures as of Monday, May 4th. And so we are here to let you know that this is a safe place for you to come to, is the hospital. If you need us, we're here for you. Dr. Mohanty, can you tell me a little bit about what you're seeing with your patient population as it relates to kind of getting back into, going to hospitals and doing things that need to be done?
All right, good. By the way, thank you for having me here. I've been working here for quite some time, and these are unusual times with the COVID. There is a lot of concern with the patients. The patients are a little bit afraid of coming to the hospital. But my message to them is this: probably one of the safest place to be is the hospital, and especially if they are having symptoms. Especially in our field of cardiovascular medicine, there is all these things are not even elective. They are mostly urgent or semi-urgent. So we have to address them. And I think that's what the patients need to understand, that when they are coming to the hospital, they don't need to be fearful about it. They are actually having more chances of getting this condition over in the Publix or walking by the beach or one of those places. So I think that is one of the main concern at this point.
I think that one of the things that really, impacts the community is what they see on TV, right? So with the media, you see a lot of hospitals that are, overcrowded and like majorly consumed of COVID patients. When in reality, here at Palm Beach Gardens, for example, our total population of COVID patients is really a very small number compared to the other patients that we have here in the hospital that we're taking care of. And so one of the things that we have seen, as you mentioned, Dr. Mohanty, is that patients are waiting. And so what happens when they wait and they don't come in for the care that they might need?
Oh, that's a very good point. Actually, that has been our main challenge at this time. Patients are having symptoms for quite some time, and they have been ignoring their primary care physician. They've been ignoring their symptoms. Even their friends and families are telling them to go to the hospital, but they're very scared to come in. And what is delaying is the care is then leading on to more serious problem. Their simple thing, which could be routinely handled as an outpatient, turns into an inpatient admission. They may be staying in a very prolonged state. Actually, I have 2 patients right now who did not listen to their physicians and did not come to the ER. And then when they did come to the ER, it was actually too late, and we had to do a lot more for them, and they are still in the hospital, intubated and very critical. Have they come, we would have taken care of them very quickly, promptly, and they would have been out of the hospital by now.
Correct.
So I think that delaying and still feeling unsafe is just not the right idea at this point.
Right. And I think part of the reasons they feel that way, again, are they're not sure of what the hospitals are doing to help protect them as a patient, or the physicians, or the employees in the hospital. And I think we have a lot of safety measures in place that allow for the safety of these individuals. Can you talk a little bit about what you're seeing here in the cath lab, for example, some of the things that we're doing for safety?
What I have seen, the administration here, the hospital staff, the nurses, my cath lab staff, they have done a remarkable job. They have actually created 2 different pathways, and I'm going to come closely to that and explain. If the patient comes to the emergency room, they automatically are screened. If they are screened for them being a positive COVID, they go into a completely separate unit. It's a separate pathway. They do not come in contact with the the regular patients. And even if when they are out of the ICU, they go to a special unit which is completely guarded, nobody can actually enter without the special permission to get in there. So patients, when they think they are in the hospital and COVID patients are just floating around here, that's just a misconception. That is not what is happening here. Then also on top of that, those who are coming to the cardiac cath lab for getting any kind of procedure, those are screened 3 days before with a COVID. So if they are elective procedure 3 days before they are being screened, then they come into a private room. They are coming through an admission site, which is again very private. They come, they are not in contact with any other patients. We do not have too many family members or people coming into the hospital. We have restricted that so that the exposure is less. And while they are in the hospital as well as in the cath lab, the people are wearing masks. The cath lab staff is completely masked. We have a lot of protection for the personal PPEs and so forth. We have not had any patients with the COVID we would have transmitted.
That is very true. And those are all wonderful points, Dr. Mohanty, that you've made. And it's with great interventionalists like you that we've been able to continue here at Palm Beach Gardens to continue the great care that we do for our cardiac patients and our community. We just want everybody to know that Palm Beach Gardens Medical Center, we want our medical staff, our community, our governing board, and everyone to know that we are here for you and we are a safe place for you to come and to get your care.
So we want to assure you that we're safe, we're here to care for you, we're always open and available. Our physicians, our staff, our facilities are ready to take care of this community in Palm Beach County.